From Elgin, healthcare. Last time we talked, me and Mary, I don't know if you recognize Mary here, brought up HR 676, expanded and improved Medicare for all, and you said you were more or less trying to improve Obamacare. But what they're doing with Obamacare is they're slashing and burning it. I have a neighbor, just had a stroke about a year ago. $3,000 a month she's paying for insurance. I mean, it's either your health or your pocketbook. I mean, would you back HR 676 for expanded Medicare? Oh, and also I want to thank you. I want to get shoulder surgery done. And now I know there's a little, not enough anesthesia. I'm not off for that for a while. But yeah, would you back HR 676 over improved Obamacare?
Thank you for the question. I think Priya can handle the shoulder surgery if you need it. But okay, so here's the situation that's facing us right now with Obamacare, and I'll come to 676 in a second. As you know, unfortunately, there's been attempt after attempt after attempt to repeal the ACA. I've been a strong supporter of the ACA, and I think we have to improve it right now to make sure that it withstands kind of the administrative, how do you say, costs, and also the administrative kind of whittling away that's happening under the Trump administration. There is a bipartisan solution that's been introduced in the Senate by Senator Murray of Washington and Senator Alexander of Tennessee. And what it would do is it would shore up the markets. It would make sure that there's less instability in the exchanges, and basically, in my opinion, kind of bring much needed long-term care to the Affordable Care Act. Unfortunately, that bipartisan piece of legislation, which commanded a lot of support both in the Senate and the House, has been stalled over one thing. There are certain folks in the Senate who want to institute their own version of the Hyde Amendment with regard to Obamacare, basically preventing any dollars that are spent for Obamacare on abortion services, which would be completely, in my opinion, it would probably be unconstitutional because these are private dollars. That being said, coming to your question, I am committed like every day right now to basically protecting the ACA, which is under attack. HR 676, which was introduced by a gentleman named John Conyers, is now kind of in flux as it's kind of taking on new sponsorship after Mr. Conyers left the House. And so what we've been asking for from the sponsors is much more information, much more detailed information about what would even a transition look like from our current system, where 80% of working age adults have private insurance, to a single-payer insurance system. Most of the people that currently have their private insurance want to keep it, but of course, under a single-payer system, they would have to transition out. So we've asked for those details. We're still waiting. I'd like to know the full plan before I sign on to everything, because it would be a massive change, and it's only fair to those who would be affected to know exactly what's going to happen. So that's kind of where I'm at right now with regard to 676. Thank you, sir.